Joining me to speak about the imminent health reforms are the head of the NHI at the Health Department, Dr. Nicholas Crisp, and Sasha Stevenson from the Public Interest Law Centre, Section 27. Nicholas, thanks for making the time to speak to us today. Earlier in the program, we heard the story of a breast cancer patient who has been waiting for almost a year for radiation treatment. And activists say that some people die while they wait for treatment. If this was your brother or sister, wouldn't you be worried?
Sure. We're worried for every patient, whether it's a family member or whether it's a member of the public. It's not acceptable. And that's exactly why we need to reform the way we deliver healthcare. We have many resources in this country, but they're not accessible to the majority of people. And the question that we are trying to address with National Health Insurance is how we achieve universal health coverage.
That may be true, but money alone is not going to solve everything. And trust in the government is really at an all-time low. And during COVID, your department had a huge corruption scandal with a Digital Vibes communications contract. Why should we trust you now to use an even bigger budget, honestly?
Yeah, so look, I think that we need to be absolutely honest and say corruption is never acceptable, and defrauding of systems and theft is never acceptable. And so when we design the structures and the way in which we execute the health system, we must make sure that the risk identification is there and that the checks and balances are in place, that these kinds of things don't happen.
So what kind of systems will you have in place?
So the first thing is to identify those risks, to try and design them out of what you are doing, and where you can't design them out, to identify them, flag them with your systems, and then address them when they arise. But you can definitely minimize the number of risks and amount of corruption and fraud by simplifying the system. And that's why this very simplified, single approach, single model is far preferable to the very complicated health system we have now.
Sasha, you are from civil society and you've been monitoring the NHI for a long time. Do you think a simplified system is going to protect us against corruption?
Well, I think firstly, it's possibly more simple than the current two-tiered system that we have, but NHI is far from a simple system. It's a system of contracting. It's a system that pools all of the funds in order to theoretically get the best deal, and so that's good. But what it requires is that health facilities and health providers contract with a fund. And with contracting, as Nicholas says, comes a lot of risk. And so we do need to put in place the mechanisms that can mitigate that risk and that can not just deal with corruption when it happens, but prevent it from happening in the first place. So there's not a lot of detail in the bill on what those systems are going to look like. So we need to make sure that everybody, from users of the healthcare system, civil society, journalists, government officials, know exactly what's going on so that there are plenty of eyes on the very, very many contracts that are going to be involved in any kind of national health insurance system.
And are you satisfied that there's enough built into the bill to involve all those sectors?
There are various advisory committees that are established that are meant to advise the National Health Fund on what kind of benefits should be allowed and what kind of payment mechanisms there should be. And those structures don't include health service users, they don't include people from civil society. I think that's a mistake.
Now, as a journalist, when I go to health facilities, I definitely get the impression that health workers really don't understand what the NHI will look like. Do you think they've been consulted enough for this bill?
There's a lot of frustration amongst healthcare workers about the fact that they don't feel that they've been consulted sufficiently. Health workers don't feel that they've really been able to influence the policy making, and I think a lot of them are feeling frustrated by that. And if we want them to implement what is really going to be an enormous change to the health system, we need to make sure that they're heard, and we need to make sure, not just because we want to keep them happy, but really because we want a system change to actually happen.
Nicholas, how are you going to give the health workers a voice?
So I don't disagree, again, that we should be consulting people. How we do it, it can't be everybody talks to the national department. You've got to be talking to the provincial department. You've got to be talking to the people in the hospitals, in the clinics, in the GP practices, in their pharmacies. And we just got to keep doing it again and again and again, and putting out materials and listening, and then adapting the materials so that people find it more understandable. My bigger concern is actually the public, the patient, because I haven't found one single person that I talk to who actually understands their medical aid now, or who actually understands how the public sector does or doesn't accommodate them if that's the service they use.
Talking of medical aid, Sasha, one of the things that private healthcare uses, even though they may not perfectly understand their medical aids, they are very upset about the NHI bill suggesting that their medical aids in their current form will effectively be banned. Do you think that's fair?
I don't know whether it's fair or not. I think what we need to focus on is the fact that, as everyone knows, we have a ridiculous health system. We have a system that caters to different people in a dramatically different way. We allocate resources really badly. It's clear that we need some kind of change in the health system. And as you say, what the bill says is medical aids will only be able to cover complementary services, so things that aren't covered by national health insurance. It's really difficult to know what, at this point, the complaint is, because we don't know what national health insurance is going to cover.
So if the NHI bill becomes law tomorrow, in the short term, what will people get in the first year?
So individuals won't feel anything in the first year, nothing. They will, at the moment, there are some people who are benefiting from some of the conditional grants, improving aspects of the system strengthening in the public sector.
And medical aids to go, is it 10 years? Is it 15 years? What's your estimation?
So my estimation, so what I see is that 76 medical schemes is not sustainable. There are big ones and there are small ones. Some are very small and their risk pools are ridiculously small. I see a realignment of medical schemes over this period where you end up with a far smaller number, fewer packages, so less complicated choices, and one compulsory package where everybody knows this is what I know I'm going to get for this price. That is negotiated and fixed between all of us, the state, the Council for Medical Schemes, with the Competition Commission and the medical schemes. That's what I would hope we would start to see in the short term. And when I talk short term, I'm not talking a year or 2 years, I'm talking within the next 5 years.
Sasha, one of the constant criticisms against the NHI is that many critics say that it's not going to be quality healthcare, it's just going to be free, bad healthcare. Do you think that's fair?
I think that's going to be a big challenge of the department in the next decade, is making sure public health facilities can be contracted by the fund, and the fund isn't just contracting private health facilities only that are able to meet the norms and standards.
And there's been lots of legal threats to prevent the NHI from happening. One of it from within the medical aid industry. Do you think there's a high chance for such court cases to be successful?
It's really difficult to say before the court cases have been brought. We don't know at this stage what the grounds will be for any of the litigation that has been threatened. So I wouldn't want to speculate. I think there is a significant chance that there will be various cases that will be brought, and there's a likelihood that will hold up elements of the rollout of NHI should it happen. While you can't entirely prevent legal challenges at all, there's certainly, I think, more that government can do. And it goes back to what we were saying about health workers and communicating with health workers to assuage some of the fears that lead to litigation, to be clearer on some of the details so that the various interest groups who are threatening litigation understand clearly what the risks to them are, what the potential opportunities for them are, and can decide whether or not they want to litigate.
Sasha Stevenson from Section 27 and Nicholas Crisp from the Health Department, thanks very much for making the time to speak to us today.
Thank you very much. Thanks to Sasha too.
That's our program for today. We hope you found it interesting. Goodbye.